now when we finally get it, we have to pay for it somehow. Now, for each hour of sedentary time per day, on average, is associated with a 14% increase in coronary artery calcification burden. This is the cardiovascular side of it, but neurosurgeon Dr. David Johnston, surely they've come up with an acronym for that. What is it called? Calcification burden coronary artery, CACSB? G'day, Doctor. Thanks for joining us.
Hello there, Claire. Nice to be with you.
Now, that's the cardiovascular side of it, but you have seen an enormous jump in patients that are coming into your neuro and spinal surgery.
Yeah, absolutely. As you mentioned, I'm a neurosurgeon, and a huge part of my practice is looking after people with back pain. You know, I trained to take brain tumours out. You know, that's what I thought I'd be doing in my career, but the burden of back pain in our society is just so massive that my practice has become predominantly a back pain practice, and that's what I consider myself to be expert in now. And I think one of the main contributors to that is very poor posture, strength and flexibility in our lumbar-pelvic region, and that's a big contributor to people's back pain.
We think past culturally when we used to be squatting down or running down, or the days when we used to be doing a lot more active work. We're not doing any of that now, and I guess the consequence is pretty dire. We heard recently that even if you do sit down all day and then you go to the gym for a full hour, that's still not as good as moving around regularly during the day.
Yeah, that's exactly right. The evidence suggests that if you spend your 8 hours or 6 hours a day at work and you think, no, that's okay, I'm going to work off that sedentary day by hitting the treadmill.
Yeah.
I'm going to reverse that, and biochemically and physiologically, the damage is done by not moving and not getting up out of that chair every 15, 20 minutes, and doing a few squats or getting the blood flowing through the muscles. And sitting sedentary lifestyles not only have a damaging effect on your musculoskeletal system, there is a metabolic effect of that. And one of the huge problems in our society today is metabolic syndrome and insulin resistance. And
that's the precursor to diabetes?
That's the pre-diabetic state, and also that central visceral adiposity that you see so many Aussies, around the food court. Just take a little wander, do your own little mental survey of how many people are overweight. And it's roughly two-thirds. Roughly two-thirds of Australians are overweight and one-third of Australians are obese.
How long have you been doing this job?
15 odd years.
And prior to that, at the beginning of your 15-year tenure, was it nearly as bad?
Oh, look, there are changes that I'm noticing as the years go by. The cohort of patients that are overweight, the different types of pathology that we're seeing now. I'm starting to see more people with metabolic syndrome and fat inside their spinal cords and inside their spines. And this is all related to insulin resistance, and we can make a difference there by changing our habits at work in particular, because we spend a lot of time at work. A lot of people will be sitting down, and there's very easy options, just modifying the workplace. A very cheap, easy solution. I've got 3 of those workstations in my office here, and I've got 2 of them at home, and it's a really easy, cheap solution. And it stops the kids from sitting in front of the computer. If you make them stand up, that's a really good way. My kids have a desktop, but they have to stand up at it if they're going to be on it.
Well, you can give us a couple of tips here now for how often you need to get up and move around. Also, posturally, I think I'm at the wrong end because I can't touch type, so it means I'm looking at the keyboard instead of the screen. That's not good.
Yeah, I mean, the spinal alignment really comes from the bottom up, and if you can maintain good natural lumbar pelvic alignment, there's 3 main curves in the spine, and if you can maintain those curves in balance, then that's the position of the spine that puts the least pressure on our discs and on our facet joints. And 80%, the lifetime prevalence of back problems in Australia is about 80%. So almost everyone's going to have an episode of back pain in their lifetime, and there's about 1 in 8 of those people, 1 in 10 people will have a prolonged period where they can't go to work, or where they're quite debilitated, and the episode is prolonged greater than 3 months.
See, if we got all this right, everyone listened to you, and they get up every 10 to 15 minutes. Is that right?
Well, ideally, if they can't create a stand-up workstation, then they sort of have to sit down, then getting up every 20 minutes, setting the little timer on your mobile phone that just beeps every 20 minutes. Just get up, have a bit of a walk around. If you've got a little bit more freedom, you could go and walk up a flight of stairs and come back to your workstation. It might just take you a minute or 30 seconds, and that would be beneficial from a metabolic and musculoskeletal standpoint.
So if you could fix all this, and all those spinal patients would go out of your surgery, and you could go back to your other favourite and removing tumours, brain tumours.
Yeah, I'll do myself out of work, do myself out of business. But I don't have a problem at the moment because there's not enough hours in the day to see patients with back pain. I can guarantee it.
And it's a big problem because when your back hurts, it's pretty hard to do anything. Everything's related to your back, isn't it?
Yep, and all the despite the increasing number of gymnasiums that you see, the exercise that is happening, we as a nation we are actually exercising more, but our back pain is not reducing. Every single suburb now, almost every major street corner has one of those 24-hour fitness centres now.
Yeah.
And they're popping up everywhere. So it's not the fact that we're not exercising, it's the fact that our long, those long durations at work and sitting in front of the TV after work, 35 hours a week is a statistic of how much TV adults watch in the US, and I don't think we would be far behind in Australia.
And we're worse now because we do all that binge watching. You get a whole DVD series and
Exactly
Game
right.
of Thrones. Don't you love Game of Thrones though, Doctor?
I do my best. I usually get home too late to watch that.
David Johnston, neurosurgeon and spinal surgeon, who's seeing far too many of us in his office for no good reason. Thanks for talking to us today, Dr. David.
My pleasure, anytime.
And I noticed that Richard French in the news booth is sitting up very straight, all the 3 curves of his spine in perfect alignment, ready to go.